being a psychologist was a kind of a good way of approaching this issue of wanting to bring about change. And I thought that could be a productive way of living my life.
Welcome to the Psychology
Psychology.
Psychology.
Psychology. Psychology.
of DePaul Psychology
Psychology
podcast, where we explore the research being conducted in the psychology department of DePaul University and how it is helping to improve people's lives. I'm your host, Jessica Chaplin, professor of psychological science, and our guest today is Dr. Leonard Jason, professor of community psychology. He has been at DePaul since 1975, which means, if I did the math correctly, that he's starting his 49th year at DePaul. And that's correct?
Yes.
49 years. That's really impressive. He earned his bachelor's in psychology from Brandeis University in 1971 and his PhD from University of Rochester in 1975, starting at DePaul the same year that he finished his PhD. He is the most prolific faculty member in our department. PsycInfo lists 620 publications. Does that sound about right?
I think it's in the ballpark, yeah.
Yeah. So that's very impressive. He's researched a very diverse set of topics, including substance abuse, smoking cessation, violence prevention, suicide, various types of interventions, including media and recovery houses, driving safety, hearing loss, how to recruit blood donors. He spent a lot of time studying chronic fatigue syndrome, as well as early in his career, things such as the pickup scene at singles bars and how to get dog owners to pick up after their dogs poop. So that's quite a diverse set of topics to research. So welcome, Lenny. It's fantastic to have you. I want to start off by asking about your early life experiences and upbringing, and in particular, concentrating on how those early life experiences sparked your interest in the scientific study of psychology.
Sure. I think some of my early memories have to do with kind of reading about World War II, some of the persecution of different groups during that war, the extermination of over 6 million Jewish people. And I think thinking about the pogroms and the other types of kind of persecution that have occurred for many groups, including the group that I was identified with, being Jewish, I think it just attuned me to the need for some type of activist position in my life. And very early on, I tried to be involved in different types of activism. When I was in junior high school, I licked envelopes and participated in the Johnson-Humphrey presidential campaign, trying to help a Democrat get elected. At that time, there was a lot of civil rights tensions, and there still are. Johnson and Humphrey did get elected, but I was very disappointed that they also got us very involved in the Vietnam War, which I was very opposed to. When I was a senior in high school, because of my experience in junior high school, I was asked to be in charge of young citizens group for the congressman that was running in northern New Jersey town, Teaneck. And we did get him elected, and I tried to get as much support as I could from my friends, even though I was only in high school at the time. But that particular representative ultimately ended up getting indicted for a variety of things. So that was a second disappointing experience with the political process. And I guess the third one, when I was in college, I started volunteering for Bobby Kennedy's presidential campaign. And we all know what happened to him when he was assassinated. So I thought that maybe the life of a lawyer and the life of politics was not as positive as I thought. One of my best friends in high school and I got elected to do a mock Congress at Trenton, New Jersey, and we campaigned for a law. This was in 1967 to set up an institute to study some of the psychedelic drugs that were on the market then that we didn't really know much about. And we actually got the law in the mock Congress kind of passed. And we got a lot of attention in the state for doing that. But what I realized is to get my law with my colleague Bob Manis, who got elected a very influential position so we could push it through, I sort of realized, I said, boy, what am I willing to do to get something achieved? And that kind of worried me also. So those experiences, I think, pushed me toward thinking about, um, maybe being a psychologist was a kind of a good way of approaching this issue of wanting to bring about change. And I thought that could be a productive way of living my life. And just by chance, I happened to go to graduate school where some of the people who were just beginning to form the new movement in community psychology happened to be at the University of Rochester. It was nothing planned on my part. And I had the good fortune of sort of meeting and working with one of the founders of the field of community psych, Emery Cowan. And I think that was a kind of a important experience and sort of shaped my career of saying, gee, I can really fulfill some of these kind of psychological interests as well as political interests in a field that was just really emerging in 1971. The field just had really kind of begun in this country in 1965.
Excellent. Yeah. A lot of the early social psychologists were influenced by the events of World War II. Um, which ones do you have been most influential on you in your thinking?
So probably, you know, Jim Kelly, who was at the University of Illinois for many years, um, kind of his ecological perspective. And he was a good friend also. Um, and but I would say, um, and if you can believe it, I I met B.F. Skinner um, and had breakfast with him at one of the conventions. Um, and I was very interested in kind of bringing about behavioral change. And I was kind of trained as well in behavior analysis. So that was influential. Um, and I also went to Brandeis to study with Abraham Maslow. So that was, again, influential for some of my kind of thoughts of a different type of psychology. They now call it positive psychology, but it was called more humanistic psychology at the time. But I would say of all those people, it was really Emery Cowan.
Uh-huh.
Emery Cowan was a clinical psychologist who kind of said during my first year, I'll never forget, saying, there's never going to be enough psychologists to meet the needs or the um, demands for services. And if you look at the effects of outcome studies with paraprofessionals who don't have training but have supervision versus professional clinicians, at that time, Joe Durlak and others were finding not too many differences in outcomes. So in my early days, I said, well, gee, if there's not enough of us and we're not really that much more effective, what am I doing? But the alternative was really grabbed my attention that we could really think about a more public health psychology where we could, which Emery talked about, deal with prevention rather than just treatment, be a more active stance going out into the community, um, trying to think about working with community organizations and groups, working with the media. So all these types of things were revelations to me. because they were exactly what I wanted to do, to be a more activist person, and I can now do it as a psychologist. So,
Yeah.
In a very short time, it became very clear that the clinical community psychology domain was exactly what I wanted to do. It brought together my political interests of trying to bring about social change and psychological interests of basically understanding the underlying kind of reasons for why people did things.
Excellent. Excellent. Um, one goal for this podcast is to give students ideas on possible career directions. Um, so I want to start talking about your early career uh, as an inspiration for some of our students. Your dissertation was on economically disadvantaged children, and you investigated educational intervention to help those children. Uh, what caused you to choose that topic, and what
So,
inspired you?
sure, when I was a first year graduate student, my advisor, Emery Cowan, had a fourth year intervention group where everyone was going out into the community doing remarkable things. So, as a first year student, I decided to sit in on the class without asking his permission. So, as you can see, I was probably a little bit different even back in those early days. And one of the people, a person named Clarefield, was doing an intervention with young children, infants actually, 12 to 24 months, who were basically not speaking, were not walking, um, and had lots of kind of all types of hurdles that they had. And he was doing an infant stimulation program, 1971, but it wasn't evaluated. It was just having DePaul, University of Rochester undergraduates working with the children a couple times a week. And I thought it was wonderful. I mean, we'd go into Baden Health Center. We would, and I decided that I was going to make that my master's thesis. So I took films of the youth doing Bailey scales of infant development and other kind of measures. And then at the end, we had films and we rated the interactions. And we just saw the kids, um, had a wonderful transition of being able to begin talking, begin able to walking, becoming more socially engaged. And I stayed with that project for 4 years. Um, so not only was my master's thesis, but it was my dissertation. And by the end, I became the director of the program. And what I was doing was we had um, a randomized design. Some people got the program, some people didn't. And then those who didn't get it eventually did get it. So everyone got the program. We had several times a week, the youth were picked up at their homes and brought to the health center and interacted with University of Rochester undergraduates. We had sessions in the home for the parents, and we had group sessions with the parents. It was a very comprehensive program. And at that time, I was very trained in behavioral skills, so I knew exactly how to shape behaviors. And I was studying in a kind of a Skinnerian type lab by a person named Stanley Sapone, who's in linguistics. And I actually took my comps minor in linguistics. So I learned how to do behavioral operant conditioning. And I took that experience with being able to help these youth go through a whole series of curricula, even though they were 12 to 24 months. And at the time, it was pretty advanced. And we saw enormous changes when we basically provided this enriched environment. So I was hooked. Basically, preventive, going early, working with systems, kind of getting something established in the community that would be sustained. It was very exciting, working with individuals who, had very few resources. And, I was, I just felt that this was, you know, the type of work I wanted to do. And when I came to Chicago, after I graduated to DePaul University, I shifted my experience to schools, and I worked in schools for many years. And we had something called the DePaul Mental Health Center, and actually, um, I worked part of my time out of that mental health center, developing preventive interventions in schools.
Excellent. Another goal for this podcast is to introduce students to research methods and those types of concepts. Um, so with these interventions, do you have controlled subjects, randomized assignment to conditions, that sort of thing?
So, in my dissertation, there were individuals who were randomized either into the intervention or a control condition. And when the intervention was over, um, those in the control condition got the intervention. Um, so we have follow up on the intervention and a replication of the intervention for the other group. So, yes, it was a randomized design. And since then, I've done a number of studies that have involved um, multiple different methods, from quantitative to qualitative, to quasi-experimental to experimental, from social networks, which is some of the kind of recent work we're doing.
Yeah, very nice. Um, so, in addition, in your early career, you did some things that were very different from that main thrust of your research. There was the study that you did in the singles bars in Rochester. What inspired you to take that side project?
So when I was a graduate student, one of my best friends was David Glenwick, and we would kind of on weekends visit some of the singles bars. And one of the things that we, as budding psychologists, kind of noticed that there was a social psychology hypothesis that potentially the most attractive people would get kind of the most people that would come up to them, but that if a person was very attractive, it was possible that other individuals might be afraid to approach them. So it was really a social psychological kind of framework. And we basically just started taking notes with kind of materials, stopwatches, and we really looked pretty odd in these single bars. And we collected a ton of data. And we just looked at people, observed how many contacts they had. And what we found was basically that, um, you know, there was really very little relationship between the individual's level of attractiveness and how many times they got approached. In fact, most people didn't approach anybody. Um, so the average seconds was really minimal in terms of approaches. And I think what that suggested to us was that people were just kind of worried. So at the end of our observation, we just walked up to the people and we asked them to see if they were friendly. And again, just about everybody was friendly to us. So that particular study has probably gotten more publicity. And we had people asking us to do book proposals. Um, we were on Hollywood Squares, where that was one of the questions of number of seconds, was kind of people would meet others. So it was surprising that that study, which we thought was published in an obscure social psych journal, would get as much attention. But we had a great time doing it. Um, and the funniest thing was, the last people that we walked up to, and we basically asked, kind of just to see if they were friendly toward us, and we asked them what they were doing there. They said that they were doing a bar study. So we were pretty funny. They were joking us, but they must have seen us kind of with our papers and pencils with stopwatches. But no one ever bothered us. It was really very unobtrusive, and we had a blast doing the study.
Yeah, that's a fun one. So, yeah, and then another paper that you published in the 70s was was to it was an intervention to try to get dog owners to pick up their dog's dog poop. Um, what inspired that research?
So I asked the alderman, 43rd Ward, to come to my community psychology graduate class, um, and his representative did come. Um, and I said to myself, I'm going to ask this person whatever he says, what's his most serious problem in this community, and I'm going to work on it because I want my work to be focused on the concerns of the neighborhood. And when the alderman representative said that the thing that got the most complaints and problems for him was dog droppings, my mouth fell open. And, I kind of figured, okay, well, I would collect some data on, questionnaires. And I found that, just about most people found uncollected dog feces about the most aberrant, abhorrent kind of litter. And it was all over. Nobody was picking up. I mean, this was 1977. And so I sort of got intrigued, and we began just doing a series of studies. We did about 6 studies, and we were, we'd even go up in buildings and look down and kind of just watch, and people weren't picking up, and it didn't seem like anything was working except when we walked up to people and just did a modeling and said, please pick up after your dog, and showed them how to use a scooper to do it. And then over 90% picked up, and we were able to, actually sweep the streets every night to find out the weight of the dog litter. So when Marty Oberman actually introduced legislation at City Hall, and knew about the work we were doing, he invited me to come down, and I testified. And boy, it hit all the newspapers, it hit all the TV programs. They couldn't believe that a psychologist was studying dog feces. But it, what Alderman Oberman said was that my willingness to tackle this problem, to show how it could be studied, how it could be changed the perception of the city council. And Chicago really became the first major urban area to begin kind of dealing with this problem, with making people pick up after their dogs. So it became a sort of a funny story that eventually I said, I probably shouldn't stick in this area. I'm sort of being stigmatized. And the reason I said that was, as a young assistant professor, I went to American Psychological Association meeting, and my advisor, Emery Cowan, walked into a social hour that had about 100 people, and he was on one end of the room, and I was just walking in the other end. And this study had been getting some national attention, and he kind of boomed out saying, "There's the dog shit man." And everyone in the house looked at me, and I said, "I'm out of this."
Yeah,
I said,
absolutely.
"That's enough."
Yeah. Yeah. So again, so you said you ran 6 studies for an undergraduate who is learning research methodology. Can you walk through like one of those studies as you would a undergraduate research methods class?
Well, you know, we had people counting dog litter that was uncollected, the color of it, um, and we had them watching kind of dog owners on top of McCabe Hall, and just sort of looking 5 hours a day of observing and collecting data. So we had them involved in helping writing up some papers. But I must say, trying to get people to work with you on a study like this is a little bit of a challenge. And if I can tell a funny story, um, I remember Francis, who was assigned to me to be working with me. He was going to come into the clinical program. And the first day he came in, I was saying to myself, I'm going to have him working on dog feces, but he wants to be a clinical psychologist, and he's going to probably wonder, what the hell am I doing? So I said, Francis, could you tell me about some of your hobbies? And he said, well, I like to hunt. I said, well, I don't know anything about hunting. Can you tell me, what do you do when you hunt? He says, well, you go in the woods and you try to track the deer. And I said, then what? He said, well, if you see deer poop, you put your finger in it to see if it's warm, and then you know it's not that far away. I said, Francis, you're the man for me.
Yeah. hysterical. Um, Great. From there, you started thinking about other topics, as you said you wanted to not just be associated with dog droppings. What inspired you to study other topics like smoking cessation?
So when I was a graduate student, um, I looked at the literature as the thing that killed the most people. And if you're interested in prevention, you know, basically tobacco, it kills more people than anything else. It's like, hundreds of thousands of people. So I went to my advisor and I said, I'd like to do some work on tobacco. And well, unfortunately, my advisor, Emery Cowan, was a chain smoker. So he didn't find that very interesting. So I had to wait till I kind of came to DePaul in Chicago in 1975. And what I really worked on for many years is how do you get kids not to begin smoking, prevention, and how do you protect non-smokers by what do you do to kind of set up no smoking sections. And this was before there were really any laws on non-smoking sections. So those are the two things I worked on for over 30 years. And the work that on tobacco, I first ended up focusing on the kids on prevention, like ninth graders, developing programs to help them resist the urge to smoke. But the kids kept coming up to me and saying, if you're really interested in prevention and smoking, why are all the grocery stores and pharmacists selling us tobacco? And this was in kind of the late 1980s. And so what we did was we actually sent 12th and 3rd graders into a bunch of neighborhood stores, and almost all of them sold. These are young kids, and they're not supposed to sell. There was a law against it, totally unenforced. So for the next long time, we just worked with communities, and we basically tried to develop procedures, and initially started with Woodridge, Illinois, because we got a lot of publicity for some of our early studies. And a police officer said, I've solved the problem of youth underage access to tobacco. And I said, Officer Talbot, how did you do it? He said, well, we sent a letter out to 29 merchants in Woodridge and told them it's illegal to sell. So I said, Officer Talbot, it's nice that you're doing that, but it's very profitable to sell. And I'm not sure that's really going to have an effect. So he invited me down to collaborate with him. And one of my undergraduates, Peter, um, basically, and I worked on a study in the late 1980s where we basically, in Woodridge, had people go into the stores, try to get tobacco, over 70% sold. And then we set up laws that Woodridge passed, that Officer Talbot helped develop, that basically said if you sell, you might lose your license and you'll get fined. And we're going to send people in, youth in, to see if you're actually complying. And Woodridge became the first town in the country to basically stop the sale of underage tobacco to minors. And that officer became a national figure and helped with the passage of Sinar Amendment, which ultimately then required every state in the country to reduce access to tobacco by the methods that were pioneered in Woodridge.
Yeah, excellent. Um, and then what inspired you to study chronic fatigue syndrome?
So I actually refer to it as MECFS, and ME stands for myalgic encephalomyelitis, and CFS, chronic fatigue syndrome. And the reason is because a lot of patient activists kind of feel the term chronic fatigue syndrome just focuses on one symptom, and it's actually much more than fatigue. It's not just chronic fatigue, it's really kind of post-exertional malaise, cognitive impairment, unrefreshing sleep, and a variety of other kind of symptoms. Um, so, and for a long time, it was really very um, considered um, unclear, um, maybe hysteria. A lot of people had a lot of questions about it, but since SARS-CoV-2 has infected so many millions of people, and long COVID has now occurred. This illness is now, for the really first time, I think, being given really serious attention and respect that it's a legitimate illness. In 1989, I actually got mono myself, and after I got mono, I just really felt really pretty sick for a while. Something like Epstein-Barr virus generally is thought of as the cause of mononucleosis. It's called infectious mononucleosis, and something like about 10% of people have difficulties recovering. And I was one of those. So having been touched by this myself, and I decided that I would make this a focus of my research because I felt the name wasn't good, the epidemiology was very poorly done, the diagnostics was terrible, the case definition was not empirical, and just about all the research was flawed. So I said, boy, as a clinical psychologist who has some good research methods, I thought I could make some contributions to this area.
Yeah, excellent. What advice would you give to aspiring researchers, young aspiring researchers, on how to pick topics for to study?
Well, I think you want to pick something you really care about. If you pick something that is just something that someone else gives you, it's probably not going to be an enduring kind of topic. And I do think it's important to stick with things for a long period of time. You know, I've been working with substance use for my entire career. Um, I've been kind of interested in MECFS for the last, over 30 years. But by really learning a topic, you find out the interesting issues, you can find the places you can make a contribution. It's very unusual for someone to just jump into a field and to really make an impact. So I think the only way you stay in something long enough to really find out the institutional barriers to change and to find who the critical players are that you want to work in alliance with to bring about change is to find something that you'll stick with. And why do you stick with something? Because you really feel strongly about it. Um, and it could very well be that some of the small wins that you get, some small successes that occur, allow you to keep that burning intensity that says that you're going to basically make a difference. So stick with it. And if you stick with it, you can have a lot of obstacles, a lot of barriers. And if you can get through those obstacles and barriers, you have, I think, a greater chance of really doing something significant. But it all starts, every piece of this thing starts with that underlying motivation of saying, this is something I really care about, and I'm going to work on it, and I'm going to keep going at it, regardless of what anyone says to me or any types of obstacles I encounter.
Excellent, excellent. So, reflecting on your huge body of work so far, what work are you most proud of?
Well, certainly when I mentioned youth access to tobacco, that was very important to find an innovation with collaboration with Woodridge to show that you could really reduce minors' access to tobacco and access to tobacco in basically commercial establishments, stores, mom and pop stores selling tobacco was one of the leading ways of 3,000 youth beginning to smoke every day. So that's probably, in terms of an achievement, that I feel very fortunate to have been associated with. But currently, my MECFS work has been, I would say, three areas. One is when I started working in MECFS, I think people had estimates of prevalence that were very low. I was able to do really good community-based epidemiological prevalence research with both first adults and then children, pediatric group, and those estimates have helped make people realize that it's not a kind of relatively rare illness. So that's a good thing. And certainly some of the current work with prospective kind of studies, I think, have become even more important given what's happened with SARS-CoV-2.
Excellent. Yeah. Can you recall a time when your findings led you to reconsider your initial hypothesis or approach? Um, and how did you adapt in response?
So when we do research, we're constantly going down alleys that don't seem to be productive. And it gets very complicated. And sometimes you have to just kind of stop and say, um, it's not going anywhere, a particular line. Or sometimes you just keep kind of pursuing and eventually kind of say, okay, well, this helps explain it. I would say the most common experience that I have is um, kind of getting confronted with data that's complicated. Um, to give you an example, we found out in recovery homes, which is something else that I study, that we've been working with a group called Oxford House, which has over 3,200 recovery houses that all you have to do is not take alcohol or drugs and you can stay in there as long as you want. So it's really a cool community-based intervention. Well, one of our findings found of looking at social networks, which is kind of like the connections between people, looking at friendship and willing to loan and advice seeking. Well, we had a finding that came up that indicated that if you sought advice from others, it led to worse outcomes. So, so everybody in the house rates everybody about um, how much they seek advice, and it's what's called a home network. So everyone rates everyone. We had people in over 40 recovery homes in 3 parts of the country provide us this data every month for 3 months. So we had over 600 people in the sample over 2 years. So it was a pretty good data set. And, what do you do with the finding that says you're supposed to go there to seek advice and try to get help from your peers
Yeah.
and try to become able to stay sober or abstinent. And here we're finding actually the more you seek advice, the worse your outcomes are in these sober living houses. So that was a stumbling block. And then later on, we found out by looking a little deeper that who were you asking advice from? So if you're asking advice from people who are less recovered, don't have the same recovery or less, then it's going to lead to worse outcomes. But if you seek advice from people who actually have a higher recovery factor, or what we think of a sense of kind of being able to be really abstinent and sober, um, and have all the different qualities that we call recovery, actually that leads to better outcomes. So it's kind of looking kind of at the dynamics, and we as psychologists often just look in somewhat simple terms. The world is much more complicated. It's dynamic. It's constantly
Absolutely.
changing.
Yeah.
So I affect Jessica, Jessica affects her audience, and her audience eventually is going to affect me. So there's triads, and very little in the world is just linear, which is how we generally look at the world. So that's why we've been very interested in social dynamics and the social networks, because that lets us look at bidirectional effects, effects beyond one person affecting another. And in these more complicated models, which we do using a program called RCNA that was invented by sociologists, we're able to come up with these types of findings that are really exciting.
Yeah. Excellent, excellent work. Um, so, yeah, your research has done so much to help people's lives in really concrete ways. Um, so, you must be really, really proud of that. That's really a testament to um, your fortitude and your perseverance studying these topics, and hopefully, as our field would um, have that aspiration to help people, um, uh, through discovering these social dynamics and so forth. Um, Many of our listeners are students who face personal and academic challenges. Can you share some of the challenges you've faced in your journey and the strategies you've used to overcome them as a way to reassure the students that such hurdles are a normal part of life?
So, my interest has been in social change, in everything I've been involved in, from my early days of kind of working with presidential campaigns, Johnson Humphrey, to today, has really been fortunate to think about kind of the broader potential impact. Um, and when one tries to focus on those types of larger kind of outcomes, you're going to have many challenges and sometimes very unexpected circumstances occur. So I'm constantly amazed at how we focus so much on first order change, which is kind of like putting a bandage on someone's wound, as opposed to what we call second order change, which is more structural and systemic, and changes sometimes the resources and the roles that people have. So the young people today who are undergraduates at DePaul are faced with challenges that I never had. Um, Mental health issues are skyrocketing. Substance use outcomes, mortality, skyrocketing. Um, and we have, more uncertainty about the climate. We have more uncertainty about just a variety of things than I did. Although in my formative years, um, I had to worry about and concerned about the civil rights and women's rights and Vietnam War and lots of things, but they're just not the same as today. So what I have had to do for myself, and what young people today have to do are probably very different. So I can just really speak for myself. And um, if you are a young person and you want to be involved in some type of global issue, which might be the weather and climate, it might be poverty, it might be social injustice, it might be um, you know, things that happened to George Floyd and with, violence. Any of those areas, I think I rely on, think in terms of not just first order change, but second order change, kind of more structural change. But the only way we can do that structural change is by, in a sense, thinking a little bit differently. We're not going to probably do it ourselves because there's all types of status quo and there's all types of regularities that are very powerful, and they're way beyond the types of resources we have. So the only way that happens is if we make alliances with groups and individuals who have power. And they could be patient groups, they could be citizen groups, but there's got to be alliances, and we can work with them and trying to bring about what we think of as second order change in any of these areas. And what do we as psychology students bring to this equation, I'd say two things. You know, we bring um, the methodology of being able to determine whether something actually works or doesn't work. And we don't have to be committed to something that's ineffective for our whole career, which unfortunately some people do. So we've got a good research background. And the second thing is we have patience and willing to keep connected with something for a long enough period of time to make a difference. So those are the principles that I've used, I continue to use, and if I think those principles could be used potentially by others who are trying to make a difference.
Excellent. How do you involve students or junior researchers in your projects?
So when students come to get involved at my center, and I'm the director of the Center for Community Research, and we've been here since about 2000, so over 20 years. And during that period of time, we've had over 250 people who have been either volunteers or staff at my center who have gotten into graduate programs. So I'm very proud of that record because, we have been a group that provides experiences and opportunities. And, I get messages from these people every week about what they're doing in their lives. So that makes me very happy. So, so what I try to do when someone comes to our center is find out whether they're interested in the topics that we do work on, which involve violence prevention with my colleague, Dr. Robinson, or whether it involves something with substance use, addictions, which involve my recovery home work, or involves post-viral illnesses, which involve things like ME/CFS and long COVID. And then within one of those areas, I try hard to find out how they can possibly come to team meetings, see if they enjoy what's being said at the meetings, and maybe they can work with someone at the lab or possibly a graduate student, or maybe they have their own idea. But I think the key thing is, can they find something that is nourishing and something that they really feel they're getting something out of it? And if they do, that's great. And we're happy to provide them more opportunities. And we have, lots of kind of staff and volunteers that work here. This last year, just to give you an example, Aiden came up to me. He was in, I think, a sophomore, and he said, I want to learn about grant writing. So I said, well, um, I've spent my career trying to get money so I could do things, have certain independence, very entrepreneurial, but that's what I do. I really write grants and to the federal government, and when the grants come in, I can do what I want and have fun doing my research. So I said, if you want to learn about grants, you're in a setting that has all types of opportunities to get funding. Why don't you find out what's available at DePaul and make a listing of everything that's available for undergrads, grad students, faculty? So we spent a couple months working with the listing, and he did. And then when he came up with a very good list of things, I said, well, why don't you apply to something? You know where the money is. You want to learn about grants. So he said, okay. So he applied for a grant with a Suveta, who's an incoming clinical community student. And Suveta and him have been working on a study, which is a consensus document of dealing with the case definition of ME/CFS. They've been working on it this summer, and his summer employment ends this Sunday. So I said to him, time to start looking for another funding source.
Yeah. Excellent. Excellent. Looking ahead, what are some upcoming projects or research that you're excited about?
Well, I certainly see lots of opportunities in the kind of MECFS long COVID area. And, we're doing a lot of work with Jacob First, who's in the computer and digital media program on data mining to try to come up with case definitions for long COVID. We have a longitudinal study where we had 4,500 undergraduates donate blood and also fill out some self-reports, and then we waited to see who developed mono, and then we followed them over the last 6 or 7 years. So it's a prospective longitudinal study, and that's continuing. So we have basically literally thousands of people that we're contacting, and we're also recruiting a new sample of kids from who have long COVID. So, so we have lots of research in that area that's going on, and certainly people who have interest in long COVID um, or MECFS or post-viral illnesses. That's something that we do work on, and again, that's just one of multiple projects. So for an undergraduate, what I would suggest is maybe go onto the DePaul website, different psychologists, see what psychologists are studying,
Mm-hmm.
find out which area maybe is a match with the undergraduate's interests, and then maybe sending an email to the person and maybe setting up an appointment to talk to them. And that way they can see if there's opportunities in their lab for getting some more experience. So yes, um, and if one person doesn't have an available spot, then you just keep looking
Yeah,
because it's persistence that counts in this
absolutely.
field of psychology and in anything one does after one graduates.
Absolutely. Excellent. So before we wrap up, is there anything else you'd like to share that we haven't touched on yet, or any other thoughts for our listeners?
Well, I think this podcast, I'm just very grateful to be the first person interviewed. Um, and I thank you for taking on an opportunity for me and other faculty to share our experiences, our lives, why we want to be a psychologist. Um, what was it that got us interested in the field, and I think that this series will be extremely important for our undergraduates to get to know the faculty.
Excellent. Yeah, that's the hope. Thank you so much for this fantastic interview. I do think that it will inspire both undergraduates and graduates to get involved in research, um, as well as for us faculty to get to know each other better. So, thank you so much for joining us.
Thank you.